So my project was on Enterobius vermicularis. The history and biology of it, so it's a parasitic infection. There's different names for it, so it goes by Enterobius vermicularis, pinworm, threadworm, or seatworm. It's originated from the Greek words enterial, which means bowel, and bios, which means life. And it also originates from the Latin words, which vermicularis means small worm. So it was first found in a prehistoric man's stool 10,000 years ago. So that's when it was first dated as an infection. So it is the oldest and most common parasitic infection in the human species. So pinworms, they start out as little eggs and they don't tolerate heat very well, so they're most efficient in tropical weather or cool and moist. They're colorless spears and are flattened on one side and very small. So the eggs are very sticky and able to live up to 3 weeks in the correct conditions. So once these eggs enter your body, they take about 6 hours in body temperature to become infective larvae. So the larvae then turns into the adult Enterobius, which appears in our bowels. So in adult Enterobius, they're very small worms. There's females and males. So the male worm is about 2 millimeters to 5 millimeters, and they fertilize a female worm, and they die and pass through our stool with no symptoms. And the female worms head to the rectal area. They lay their eggs, and they lay about an average of 10,000 eggs, and they die. And they lay these eggs around the perineum area at night. So the cause of these eggs or this infection is the inhalation of eggs through the nose or mouth. So a child will get the infection. The female worm will come out at night of their anus and lay their eggs around the perineum area. So after these eggs have been laid, their eggs the child can get itchy and itch their anus area, and these eggs can get under their fingernails, and these children will touch surfaces and spread the eggs throughout their environment. So the eggs can also become dislodged from their surface and disperse into the airflow. So if they lay their eggs in their bed and the eggs are on their bed sheets, the mom comes to make their bed and she, shakes up the cloths and stuff, it can dislodge the eggs, and the eggs will enter the airflow where people can just breathe in these eggs into their bodies. So due to these eggs' survival rate, which is up to 3 weeks on surfaces, it is said that it's more likely that one member of a family will be infected at the same time. So some symptoms of pinworm is the main symptom, which is anal itching. So studies do show that perineal itching is not more common in an infected person than an uninfected person. So usually it's pretty asymptomatic. There's no symptoms. Other symptoms can come as insomnia, loss of appetite, abdominal discomfort, and the infection can lead to appendicitis, UTIs, irritable bowel syndrome, or vaginal discharge in females. So since there usually aren't any symptoms in this infection, it's really important for parents to check, if they feel that their child is even itching, or if they just want to check casually here and there so they can maybe see if their child does have it. So the diagnosis, parents can identify these worms with a bright light. So they could lay their child down and use a bright light to look at their perineum or anus area to see if the worms are visible. These worms are described as thread-likes, and they're kind of moving away from the anus. So the eggs, you can't really see them with a naked eye. You really have to put them under a microscope to be able to see them. So this leads to usually the tape test. So if you want to diagnose your child and be for sure, you can take Scotch tape, place it around the anus to pick up the eggs, then put the eggs under a microscope to see if there are eggs. So the tape test is usually only successful when done through 5 consecutive days, just because of the female's inconsistency to lay eggs every night. Like sometimes she'll lay eggs on this night and not this night and this night. So usually it's important to do it 5 days consecutively to get the best results with the tape test. So some statistics prevalence. So there's 200 million of the world population is infected. School-age children are most commonly infected, followed by younger children, and then adults between the age of 30 and 39, just due to their kids being infected and they could get their parents infected. The prevalence rate in some communities is 30% to 50%, and some environments that are at high risk would be crowded living situations, just because you can spread it more often, community homes, schools, summer camps, families with a high number of members. So yeah, just a lot of environments where there's not good hygiene, or like there's a lot of people where it could be spreaded more easily. So the impact on our community. So CNN did an article in the headline Enterobius Vermicularis as a back-to-school worm. So if your child has this infection, they don't have to stay home, but the schools must take precaution to warn other parents and also take measures to increase their hygiene to prevent the spread of infection throughout the school. So I think we should be aware of this just to observe and keep up with this issue so we can prevent any huge outbreaks in the school system. There's also events such as like I know in London they did a Threadworm Action Week, where it's just an event to educate on good hygiene and to educate on prevention, or like prevention of reinfection. So some treatments, usually when one member of the family is infected, all family members must be treated, because it's highly likely that if someone is infected in your family, it's going to spread to you. So the medications that are used is mebendazole, which is for adults and children over the age of 2, and that's the preferred medication. Then piperazine, which is for adults and children over the age of 6, and it also comes in syrup form for infants. So this is an ideal for first trimester pregnancy, which is why I think mebendazole is the preferred medication. So young eggs and young worms are more resistant to drugs than adult worms. So the first dose will kill adult worms, but sometimes the young eggs and young worms are resistant. So after the first dose, a second dose is then repeated to make sure that the infection is completely gone. So another key factor to treating this is hygiene. So it's also important for preventative measures. So you thorough hand washing, make sure you wash your hands for 20 seconds with soap. You want to cut your children's nails short and prevent them from the spread of eggs, thumb sucking, or nail biting. With cutting your child's nails, you also want to keep their nails very clean. You want to discourage the itching of the anus area. Daily showers, daily laundry, handle cloths with care. So like I talked about before, if you shuffle, through bed with eggs, it's just going to go in the airflow. So you also want to open windows because eggs are very sensitive to light. Hygiene can also be very important in treatment because it will help cure the reinfection rate. So after you get treated, you want to make sure you keep up on this hygiene so you don't get reinfected. Reinfection is very common. There's a 50% chance to become reinfected within 12 months. You're pretty much just given another course of medication, and it's hypothesized that it's unlikely due to failure of the first course of oral medication, but to poor hygiene after the first infection and treatment. That's why I was kind of saying that, hygiene is really important to keep up with in treatment because you don't want to get reinfected. So follow the steps of hygiene, and that should lower your chances of reinfection and preventative measures. So overall, Enterobius vermicularis is still an ongoing infection, and it's really important for us to understand it, prevent it, identify it, and treat it. So understanding the history and biology will help us understand how the infection works. Understanding the causes, symptoms, and diagnosis will really help us understand how to identify it and prevent it. The statistics and prevalence will just let us be more aware, raise awareness of where it's happening and who it's happening to, so we can identify it quicker. The impact on our community is just there, so we know that it does impact our community. We are aware, and we do want to prevent it from happening. The treatment, it's just really important to know how to cure it if you do find that your child has it or if someone does have it, and it's really important to understand reinfection and how to prevent it. So yeah, that is my disease.